You are here with us on Mums at the Table. I'm Rachel.
And I'm Shona.
Now today coming up, we've got Dr. Peter. He's talking about women's health for us.
We do. And if you have any questions for the GP, send them in and we'll answer them for you.
And that's the same for Dr. Peter and as well Amanda, who's our dietitian. So she talks all about food and nutrition that's, really good for our kids.
And your body.
And your body, yes. Today we've sort of been talking a little bit about the topic of disappointment, and I think, marriages are really hard. They can be really tough, and overcoming some of those disappointments is a real challenge.
Yeah, because you're coming from two different families with two different sets of how they argue, how they resolve things, even just how you live together. You're bringing all of that together, and it can be a major drama.
Yeah, it can. It can set up some really volatile situations, can't it? But what do you do? As you said, differences come together, but what do you do?
Look, for me, I think, and we faced a number of them with having, the children weren't always well, and then having my family overseas, so we didn't have support system that way.
That can make it hard.
It makes it really hard. So for me, one of the big things was having a church family where you could have someone to look after the kids and to help you out and to have discussion with, so that you could actually see that you weren't the only person who was going through these types of issues.
And it is sometimes hard to have those discussions when kids are around all the time. So you've tapped into, your village that you had to sort of enable some of those conversations to happen. Yeah, look, there are things that Chris and I have sort of come to blows on. And I think one of them is health. I'm so passionate about the kids being able to have healthy food, and he's not on the same radar. And so when I was away, or he was cooking the meal, I'd come home and I'd be like, "You've given them this, this, and this, and this," and I just failed to see. Hang on, he actually kept the kids fed.
Yes,
they're
alive,
happy and they're okay, and they'll pull through. Whereas I was just so stuck on my agenda. And that's one we've dealt with for years.
Yeah,
taking that sort of humble card and going, "Hang on, Rachel, Chris has these amazing strengths. He's so happy to step up and look after the kids, so I can go and do all sorts of things."
Yeah.
And I focused on the wrong thing, and sometimes that's where we get stuck.
Yeah. And look, sometimes I know for us, we got into a really big quagmire sort of halfway through.
I love that word.
Oh, it was a quagmire. You needed gumboots. We ended up having to have counselling because we couldn't find our way out of it. So, I don't think we put the stigma around getting help, but I don't think you should. I think if you want to save your marriage, then that's something. If you're in that quagmire, you need to go and get it looked at and seen to.
Yeah, I think you're right, Shona. We do need to invest in our marriages. It is something precious, so we need to take the time to do that and seek professional advice if we need it.
Hey, we're talking about exercise. How often should we be exercising, particularly children? It's so, we're indoors a lot these days, keeping safe,
Yeah. I think as a rough rule of thumb for children, I think it's important that they get at least 1 hour of moderate exercise.
What's moderate? What's your definition of moderate?
Well, it's certainly not walking to the cupboard or walking to the bedroom. I'm talking about, playing a game of chasing outside, or riding a bike, or kicking a ball around, those sorts of things, for at least an hour a day.
I know at this time, screen time has been something that a lot of children and parents have resorted to because, we've been told to stay indoors and be safe.
Yeah, a lot of questions and concerns about, screen time and how much is appropriate. And the reality is that nobody really knows exactly how much is the appropriate amount of screen time for children. But certainly I think you should see it in the context of the rest of the things that they do during the day.
Right.
Making sure they...
There's apps that you can do exercise with while
watching. Yeah, and there's nothing per se wrong with using screens. I think in some ways, particularly for their social development, it's important for children to be connected with their friends, in the virtual world, as well as real conversations with real people. So I don't think there's anything per se wrong with screen time, but it needs to be seen in a balanced way across all of the activities that the children do during the day.
Right, and how can we encourage our children to become more active?
Well, that is a tricky one, but I think it's about changing our levels of activity during the day, so that there's all this what we call incidental exercise.
Yes, I love that.
And incidental exercise essentially means all that exercise that you get without even thinking about it. Because I think most people find if you actually have an organised activity and you say, I'm going to go for a run every day or something like that, it doesn't last for a long time. But if you have incidental exercise, which takes the form of maybe parking the car a block away from school,
right?
You know,
and getting your child to walk,
or not necessarily choosing the car spot right near the shop that you're going to.
Guilty.
You're getting a lot of exercise in addition to what you would normally get.
And even getting them to do some chores around the house.
Exactly.
Great way,
all those things has that benefit as well.
Excellent. Thank you so much, Dr. Hartshorn, for those tips.
problem.
I hope you keep active, stay fit and keep healthy and keep safe during these times. Keep it locked right here at Mums at the Table.
Today we're going to talk about what not to feed your children or babies before 12 months. Now, this is a big topic. It's one that viewers have asked to talk about. And we have our specialist here, our nutritionist, Amanda. Hi, Amanda.
Hi, Gia.
So our dietitian, nutritionist is going to share a few things that you shouldn't be feeding your babies before 12 months.
Yes. That's a good one. So first of all, let's start with honey.
Yes,
so
okay.
honey can contain a bacteria called Clostridium botulinum.
Whatever that is.
Which in babies can cause botulism. And the reason for that is because their digestive systems are immature, so they're unable to prevent the botulism toxin from forming.
Oh, that's interesting.
And it can be quite severe because it can result in muscle weakness and difficulty breathing as well.
Really?
So,
wow. So it's not an allergic reaction?
No, it's this toxin forming from due to the bacteria. So, yeah, best not to give honey.
Honey's
before...
always the top of the list.
Yes. Yeah. So if you want to sweeten your baby's food, then I would suggest a puree banana or apple, something like that.
That's a good tip.
Apple. Yeah. The next one are eggs, and when I'm talking about eggs, I mean raw eggs for babies.
Okay.
So again, another bacteria, so salmonella, which can cause food poisoning. So if you're giving your baby eggs, which is perfectly fine to do, just make sure that they're well cooked.
They're well cooked, okay.
Yeah. Then I want to talk about salt and sugar.
Okay.
So I think most of us know that it's best not to add salt and sugar to your baby's food. And if you're buying pre-prepared foods as well, to choose those that are no added salt or sugar. And there's a lot of those available now. So, you know, with salt, babies' kidneys are immature still, so they're unable to remove the excess salt from their bodies. Sugar, we know that it's not good for our baby's teeth, also linked with obesity. And if you're giving your baby foods, you know, from a young age with lots of salt and sugar, it also sets them up to like those tastes and possibly make unhealthy food choices down the track.
That is a key. That's key to not set them up for those sort of things from very young.
Yeah, it's important. The next thing I want to talk about is drinks.
Okay.
So before 12 months, the only appropriate drinks are breast milk or infant formula, or if your baby needs extra fluids, then some boiled and cooled water.
Okay.
So, and the reason why, so we'll talk about, first of all, animal milks. So cows, goat, sheep's milk, none of those are appropriate before 12 months. And the reason is because they actually have quite high levels of protein and electrolytes in them, like sodium. And again, because your baby's kidneys aren't mature enough, they can't remove the excess levels from their bodies.
Wow, right, okay.
And then the next thing is juice. So juice is... it's high in sugar, acidic, again, not great for teeth, linked with obesity, again. Then the last one is tea and coffee. So I think...
Don't give your kids tea and coffee before 12 months.
I think most people know that, but coffee has caffeine, not great for babies. Tea, some contain tannins, which also reduces the absorption of iron.
Yes.
So not great for babies. The other thing is if you're giving them a lot of this, they can fill up on it, which means they're not eating enough of the, you know, more nutritious foods that they should be having.
Well, that's a lot to remember, but there were some key points there that we can use. Thank you so much, Amanda. Really appreciate it. We'll see you guys next time for some more tips.
Hey, thanks for joining Dr. Wood and I for a chat. We're talking about screening tests before you have a baby, things that we want to prepare for, obviously. Well, some of us can prepare, some of us can't. But
sometimes the pregnancy happens before you can prepare.
That's right. What are those screen tests that we should probably...
So firstly, you should probably go to your GP if you're planning to fall pregnant and just have a routine screening test to see if you need any vaccinations, like vaccinations for rubella or chicken pox, such things like that.
Because these things can pass on to your baby?
Well, no, if you get an infection like rubella during your pregnancy, it can have a really bad effect on your baby. So if you have vaccination before you fall pregnant, then your baby's protected.
So that's some standard checks.
Standard stuff.
Right.
But there's new stuff now called genetic screening or genetic carrier testing. So you may have a condition, or you may be a carrier for a condition, and your partner may be a carrier for a condition, which you wouldn't know about. There would be no family history. But if those two genes were to combine, then there's a high risk that your baby may then have that condition. For example, cystic fibrosis is a common one. 1 in 25 people carry the gene for cystic fibrosis and probably have no family history that they're aware of having cystic fibrosis in their past family history.
Right.
If you have that gene and your partner has that gene, then the combination together could lead to a baby having cystic fibrosis. So the way the genetics work is that if the two genes, if you're the carrier, the baby has a 25% chance of not being a carrier and just being completely normal, has a 50% chance of just being a carrier and still being normal,
right.
And then there's a 25% chance the baby may actually have the condition.
So I guess these tests are for parents requesting these tests to get done?
Correct, yes.
Okay.
It's a new initiative.
We pay for these tests?
At this stage, yes, but there's moves to it being covered.
Right, and so what's the process of having
the process? Normally, you need to go to a specialist or a genetic counsellor.
That your GP can refer you to?
GP can refer you to, or you can speak to your obstetrician that you're planning to go and they can refer you as well. It may just be a swab from your mouth, or there may need to be a blood test. It depends on the different tests that they're doing. And it's a simple test. You get the results back in a couple of weeks, and we will then have the results to be able to discuss it with you over the phone.
Right, and I guess parents can make the decision there as to, what...
Yeah, well, let's say, for instance, you were a carrier of condition,
right.
of a particular condition, then you could undergo IVF.
Okay.
And they can then select the embryos, they can do tests on the embryos and select the ones that don't have that condition so that you're not passing it on.
And I think that's a whole different topic altogether.
A very big, long topic, that one there.
Thanks so much, Dr. Wood, for those tips. I hope that's helped you. Keep it locked right here at Mums at the Table.
Okay, Rachel, you love being a mum. It's one of the favourite things you love doing.
She's mocking me, just in case you didn't know.
What are the 3 things that you value about being a mum?
Yeah, there's actually, I've found motherhood hard. That's no secret. I share that all the time. But as you get older, it certainly gets more comfortable. You get more comfortable in that skin. But things I've learnt in motherhood that I really have come to value is getting up and trying again. You know, there are so many times where I've gone, totally stuffed that up, got cross at the kids, yelled at them. But being able to say, do you know what, you got up every time and you tried again and you dug in.
Yep.
So that's something I'm really proud of that I've been able to do. So that's one thing. What about... you want the others.
And another one?
I think my dependence on God.
Yes.
That has been huge for me because that's gotten me through some really tough times. Parenting can be tough, and marriage can be tough, so relying on God's been a big one.
I'd have to say that's a really big one for me, is that I've learnt to let go and let God, that I can only take my children so far. God takes them the rest of the way. He covers them. He looks after them. I remember, and here's a great instance, when the elder of the 2 children got his peas, his red peas.
Licensed to
the most
drive.
terrifying time of my life, because he not only did he have independence, but he's on the road. And just being able to, like, we're watching him drive down the road and Gary is terrified. And I'm just like, God, you've got him. You've kept him alive for this long. You're going to keep him alive in this car. And yes, he's lost his licence a number of times and had some speeding tickets and everything else, but God has covered him.
Yeah.
And I think for me, I value that the most, that I can just hand them over to God and have that peace that God's looking after them.
And being able to let go is a massive one to learn, isn't it?
Yeah, especially with 2 boys really close in age.
Yeah, what else do you sort of value in what you've learned?
I value the fact now that they've left home, they come back and they have a newfound respect for home. And, they come home and they want mum's cooking.
Yeah.
Before it was like, oh, yeah, mum's cooking, blah, blah, blah. Now it's like, Mum's cooking.
So you're being valued
I'm
here.
being valued,
That's what you've
yeah.
learned. That's what needed to happen before.
That was value me.
But it's true, even when you become a parent, you sort of look back on your parents' journey and go, yeah, okay, Mum, thank you.
Yeah, you don't actually accept those things until it comes.
Yeah, appreciate it more, don't you? That is all we've got time for today. It has been great to have you with us, but please join us again next week. We've got more great topics. We'll catch you then. Bye.